There's a battle brewing on the nursing home front. A proposed federal rule pushed by President Biden aims to boost staffing and standards. The industry claims the workers needed are just not there.
But resident advocates say it's about money and not a shortage of workers. News 4's Investigates takes a closer look at what this could mean for nursing home providers that accept Medicaid and Medicare.
We're protecting seniors' life savings by cracking down on nursing homes.
Just ask around.
I hope something can change, but I'm not hopeful about something changing.
About a proposed federal standard for nursing home staffing.
The fundamental problem is the staff are not there.
And you will get...
It's completely absurd to think that there's some kind of a worker shortage.
All sorts of opinions.
I think there's a real labor shortage in this space.
The comment period is well underway for the proposed rule that would establish minimum staffing requirements and standards for nursing homes. According to a Biden White House fact sheet, nursing homes must provide at least 33 minutes per resident day of care from a registered nurse, and provide 2 hours and 27 minutes per resident day of care from nurse aides. What's more, nursing homes would be required to have a registered nurse on site 24 hours a day, 7 days per week.
We are encouraging people to comment and to speak out and say, you need to go back to square one.
Richard Mollett, executive director of the Long-Term Care Community Coalition, says the proposed staffing standard is inadequate, far below what's needed to meet basic clinical needs of residents.
The average nursing home resident needs 4.1 hours of nursing staff time. What CMS is proposing is 3 hours of nursing staff time. So that is quite alarming.
As you might expect, there's pushback by the nursing home industry.
Every nursing home would welcome the opportunity to staff at these levels. The workers aren't there.
Stephen Hance is the president and CEO of New York State Health Facilities Association, representing 400 skilled nursing providers and adult care assisted living communities. New York State already has a minimum staffing mandate of 3.5 hours of care per resident per day by a certified nurse aide, licensed practical nurse, or registered nurse. Hance says the proposed federal rule excludes LPNs, which he says are integral to the care of nursing home residents. But he says, unfortunately, LPNs are leaving nursing homes for hospitals.
The hospitals are because they have the financial ability, are offering salaries $10 to $15 more for LPNs than nursing homes can afford.
But not everyone familiar with the financial landscape of the nursing home industry believes there's a worker shortage.
There's just no such thing as a shortage of staff for nursing homes. There's a shortage of pay.
Monique Morrissey is an economist with the Economic Policy Institute, which released a report on the long-term care industry. She sums it up this way.
The pay is terrible.
Especially true of nurse aides, she says, work that's predominantly done by women.
Many of whom live at or below poverty or just above poverty. Most of whom don't have good benefits, including, health care benefits, which is tragic given that they're working in healthcare.
The nursing home industry argues that staffing is still below pre-pandemic employment levels. Add to that a state Medicaid reimbursement system described as insufficient by providers and industry trade groups.
We're at a crisis point.
In nursing homes, about 75% of residents rely on Medicaid to pay for the care. Even with New York State increasing the Medicaid reimbursement rate by up to 7.5% for nursing homes, the largest in a couple decades, Stephen Hance says it's a welcome start, but still falls short of what's needed.
New York needs to continue to invest in nursing homes so we can spend that money and attract and retain a solid workforce as we go into the future.
Health economist Brian McGarry also sees the need for more investment.
The sense that, we need to invest more in nursing homes and in long-term care is accurate.
But McGarry, a University of Rochester associate professor in the Department of Medicine, says he'd like to see more of an open book when it comes to how money is spent.
I think we need to invest more, and I think we also need to increase transparency and the ability to sort of track where dollars are going and how those are being spent, and ensuring that those dollars are actually being put into patient care.
Nearly 100 members of the House are calling on the Biden administration to put the brakes on the proposal. In a bipartisan letter sent earlier this month, lawmakers say the rule would result in limited access to care for seniors, mandatory increases in state Medicaid budgets, and could most consequentially lead to widespread nursing home closures. The proposed rule comment period for the public to weigh in closes on November 6th. So far, nearly 20,000 comments have been submitted. A final minimum staffing standard could be years away from being phased in. Luke Moretti, News 4.